Thank you, sir. The floor is now open for discussion. Anybody wants to add a point? Yes, please. Please introduce yourself and.
Did you think the future of teledermatology in terms of patients is everyone should be included, or is it more towards selected patients? Because we've done a feasibility study and we found that patients with tertiary education seems to provide more images overall, and also borderline more evaluable images as well. So is the extent to reach out to everyone, or eventually just for selected patients? I don't know what the direction would be.
Obvious indeed. Now, when a person is knowledgeable, he or she will be able to give us good quality pictures and all that. Anything for that matter. Now, even when you prescribe medication on a face-to-face basis, very few of them complete the course of the medication. So all these things should be taken in the stride of life and go with the flow. Those who accept it, it's good for them. Those who do not, they just leave it, that's all. We cannot force it down the throat of anybody.
Yeah, we also found that younger patients also, as obvious as it is, had better images. So my concern was eventually the patients who are most high risk of skin cancers are the elderly, who unfortunately will not be able to adapt this.
It's best to keep the skin cancers out of this. Best to keep the skin cancers out of this, and particularly in the Fitzpatrick 4, 5, 6 skin of the Asians, better to keep that pigmented lesions out and be careful.
Professor Thomas, I beg to differ. Thank you very much for your kind words, by the way. I'm a consultant for a company called MoMap, New Zealand. It's been established since 1997 and has had many, many, many thousands of successful teledermatology consultations. So you're referring to patient-initiated teledermatology, but teledermatology is much broader than that and doesn't just mean patient-initiated teledermatology. And pigmented lesions and non-pigmented skin cancers are the most successful application for teledermatology, even in darker skin. It's just a matter of training and expertise.
Yes, I agree with you on
and
that.
many old people are really good with their smart technology and should not be excluded because of that, or they have grandchildren who can help. So it probably depends on your healthcare setting.